Hi, this is Dr. Kingston, and in this video we'll be discussing the vascular supply of the orbit. The objectives for this video are to trace the branches of the ophthalmic artery and vein, and then to describe the relationships of the orbital neurovasculature within the cavernous sinus within the cranium. The arterial supply for the orbit comes from the ophthalmic artery. The ophthalmic artery is a branch of the internal carotid. So here's the internal carotid and here's the ophthalmic artery. It's going to branch off that internal carotid right as it emerges from the cavernous sinus. It's then going to travel with the optic nerve through the optic canal and into the posterior orbit. Once it arrives in the orbit, it's going to start to give off branches. The first branch that it gives off is the central retinal artery, and this one is a little bit different from all the others. It's going to pierce the dura that surrounds the optic nerve, and it's going to travel through that optic nerve to reach the eye. The subsequent branches that come off then are going to share the names of branches of V1 that they run with. So we have a lacrimal artery, we've got a supratrochlear artery, and if I had a little bit more on this picture here, we would see a supraorbital as well. There are two ophthalmic veins that drain the orbit, and these are both going to drain into the cavernous sinus. So the cavernous sinus, remember, is this cranial dural sinus that runs right next to the sphenoid here, and then will eventually drain by the inferior petrosal sinus down to the jugular vein. The superior ophthalmic artery, so this one here, is going to drain the superior orbit, the eye, the ethmoid air cells, and even a little bit of the forehead. It also has connections to the facial vein via the angular vein, so that's the one that runs right up to the bridge of the nose there. The inferior ophthalmic vein, this one down here, is going to drain the inferior orbit and part of the face. It also has connections to the facial vein and also down into the pterygoid plexus of veins that sit in the infratemporal fossa. These connections are important to remember because they can be a pathway for infection to spread. And they're especially important here because those ophthalmic veins drain directly into the cavernous sinus, which sits around the brain inside the cranium. Now, that cavernous sinus also has some important relationships to the nerves that supply the orbit as well. So in this picture over here on the left, same picture that was on the last slide, just chopped in half and shoved over to make some room on the slide, we can see the cavernous sinus here traveling within the dura. We can see the ophthalmic veins draining into it, and we can see some of its connections to those other dural sinuses. All right, in the photograph next to it here, so surrounded by yellow, this is zoomed right into the middle cranial fossa, and we can see what this area looks like here when the dura has been peeled away. So along the medial wall here, you can see a number of nerves traveling anteriorly. Now, a lot of these fibers belong to the trigeminal nerve, so let's go ahead and highlight these for you here in blue. So trigeminal starts back here. We can see some going that way, that way. Other side coming up here. All right, so here we've got the big trunk of trigeminal. Here we've got the mandibular nerve, or V3, going out to foramen ovale. Second division, V2, or the maxillary nerve, coming up here to foramen rotundum. And then we have got V1 most anteriorly heading up to that superior orbital fissure. Now remember, the trigeminal is very large here because it carries sensory innervation from the entire head. The other nerves traveling in this area are much smaller because they're not doing quite as much. The largest of these smaller nerves is the oculomotor nerves, which is also the most superior, so it makes it relatively easy to identify. And I will go ahead and I will highlight that for you here in green. Okay, so you can see that's relatively large. This is going to be carrying somatic motor for 2/3 of the extraocular muscles and parasympathetics for the pupil and ciliary muscle, which is why it tends to be larger than these other two. The trochlear nerve is just inferior to that, and I will highlight that here in red for you. And that, remember, is just carrying somatic motor for the superior oblique muscle. And then, just a little bit more inferior and medial, we find the abducens nerve. And let's go ahead and make that purple here. All right, so abducens nerve is carrying somatic motor just for the lateral rectus muscle. So abducens nerve abducts the eye. You'll notice here in the photograph that it sits a bit more medial than the rest of the nerves passing through this area. You can almost see it disappear deep to V1 here. Let me get my laser pointer back. So right about there, it's going to disappear deep to V1. And if I can draw your attention down into the corner here to this little illustration, it shows this relationship in a nice cross section. So most of these nerves, oculomotor, trochlear, ophthalmic, maxillary, sit very lateral on the wall of the carotid sinus. I'm sorry, not the carotid sinus, the cavernous sinus. The abducens nerve, so this guy right down here, is the only one that sits a little bit deeper into the sinus itself, so that it is surrounded on all sides by blood that's traveling through the sinus. And this has some clinical implications. So if you were, or a patient were to have a thrombosis or an infection in the cavernous sinus, it would affect the abducens nerve first. And since the abducens nerve has such a limited purview of what it supplies, just that lateral rectus muscle, it's very easy to test that your patient is able to abduct their eye. Okay. And that allows you to catch something early on before it starts affecting some of these outerlying nerves here as well. All right, I have given you guys so many hard practice questions for this session that I'm going to end it with giving you an easy one. And the correct answer is C, the central retinal artery. This is the branch of the ophthalmic that is going to pierce the dura that surrounds the optic nerve and travel right through its center to enter the eyeball. And that is the end of that. Thank you guys for watching.